Thank you for being here today. I appreciate all of you coming out and coming to hear about this topic. I'm sure you have some reason for being here. I'm going to make it worth your while. We're going to be together for around 45 minutes to an hour. I'm going to try and give you as much information as I can during that time. And I'm also going to want you to take advantage of me after the talk. I'll be here to answer some questions. If you have some questions, if we haven't gone through everything that you're interested in, I'll be glad to answer questions for you. And also you have an opportunity to have a free phone consultation or even a visit in the office, and you can decide whether you want to do that or not. It's up to you. But I would say take advantage of me while I'm here. Okay, so the topic today is non-surgical solutions for neck, lower back, disc herniations, and spinal arthritis. Well, anybody here who's had back surgery? Raise your hand. Okay. Anybody here who wants back surgery? No. Okay. And I'm here to try and help you prevent back surgeries. Anybody here who's been told they have spinal arthritis or arthritis in any of their joints? Yes. Common problem. We'll talk about that too. It's not just going to be spinal related. Anybody here have any neck problems that they want help with? Could be. Common. Very common. So these are things that are pretty common. They're not normal, but they're very, very common. So what we're going to talk about today is things that can help these problems. And all of these problems are things that during my 40 years of practice, I've helped many, many, many people with these problems and helped them avoid surgeries and decrease their need for medication. So that's part of my expertise, is really helping people try and avoid surgery and also decrease their need for medication. So one thing that I utilize is an anti-inflammatory diet and lifestyle. We'll talk a little bit about that. We'll talk about some special advanced non-surgical, non-medication methods to decrease pain and improve function. Spinal decompression is one of those things. Therapeutic massage is one of those things. Stress reduction and acupuncture. Technical difficulties. Okay. You heard enough about me, so I'm going to skip that slide. I have an associate. Her name is Dr. Rockenau. She's a medical doctor, and she got her medical degree from Columbia University and Yale Medical School. And she also has expertise in similar areas of physical medicine, anti-aging medicine. She also uses natural solutions to pain and female hormonal problems, nutritional counseling, and wellness care. Okay. I'm going to read to you the mission statement of my office. I always read this to any group that I speak to. And then I'm going to ask you something about it. And if you give me any kind of an answer, you win a prize. So, all right. We are a unique multidisciplinary team of professionals dedicated to providing high quality, effective treatment to reduce pain and suffering in a caring atmosphere. Our goal is to educate our patients, their families, our community on how to sustain a lifetime of optimal health and wellness while limiting the need for drugs and surgery. So when I read this statement afterwards, I always ask, what's most important to you? Of all the words in there, and every one of those words was carefully thought about. We haven't had to change them for 25 years. So tell me, what's most important to you? No wrong answers. Win a prize.
I like the multidisciplinary.
Multidisciplinary. Okay. You win a BioFreeze is a professional anti-inflammatory gel that I use with patients and recommend it highly. Has no side effects. It's not a chemical. It's really, really based on plants and something called homeopathy. Anybody else see anything on here that's important? Reduce pain sounds good. Yeah, I would say I'm going to give you another one of those too. Okay. All right. And you can try it. There's no harm. So I'd say give it a try. So reducing pain, really important. But, I think how you reduce the pain is really important. You can cover up pain with enough medications so that you don't feel anything. And it can be very dangerous. What's happened with the overuse of opioids. So my expertise and my goal is to try and limit someone's need for drugs and surgery. And so I want to get rid of the cause of the problem. I don't want to just cover it up. It's a totally different approach. Okay. You guys filled out one of those health and stress surveys. I'm going to ask you some questions about it. How many people checked off at least one box on that questionnaire? Raise your hands. What? Did you check off at least one of those boxes? Of all of them? Yes. Okay. How about two? Oh, you recognize each other. How about 2 boxes? Anybody check off 2 boxes? Yes? How about 3? Okay, so you've got 4. Okay. I've had people who've checked off all the boxes I have on a sheet of paper, and then they write other. And that's too bad. I mean, it really tells me that these problems are very common and not just, not just unusual, but they're so common that, everybody, almost everybody checks off at least one, but they're not normal. It's your body's way of telling you that something's wrong. And how you deal with these problems is really, really a big factor. I'm going to talk to you maybe about a different way of dealing with any kind of problem that you may have, whether it's a pain-related problem or maybe some other health problems, because I work with the whole body, not just back problems. Anybody here who checked off, let's say, headaches, just out of curiosity? Anybody? Okay. So what do you do when you get a headache? Advil, lie down. Okay, so that's a common solution that people use. The thing that I'm going to tell you is, well, I want to ask you a question about it. Do you think that you get a headache because you have a deficiency of Advil? You don't have enough Advil in your system, and that's why you get a headache. Anybody think that? No. Okay, we got a smart group here. So that's not the reason that you get the headache. The cause is something else, and people can get headaches for a variety of reasons. It can be because of pressure on a nerve. It can be because of stress. It can be because of some misalignment in their body. It can be because of an old injury. Lots of reasons why people get headaches. And the solution is most people take some sort of a pain reliever or a non-steroidal, and it doesn't reduce their chance of getting a headache again. Do you understand the difference? So if you get rid of the cause, then you're also reducing the chance of it coming back. That's the ideal solution. And the other thing is that every medication has some side effects. Advil even is not something that you should take lightly. I want you to have, after today's talk, I want you to have a healthy respect for any medication that you take. There's a study that showed that people who take 1,000 Advil type drugs in their lifetime get 8 times the chance of having kidney failure in the end of their lives. So kidney failure is a very serious illness. Wind up on dialysis, and it really, really is very serious. So 1,000 of those really very destructive to the kidneys. So every time you think about taking one, is there some other way maybe I can get rid of this headache, or maybe I can do something differently so I don't keep getting headaches? That's what you should be thinking about today. Is there some other way that I could do something about any of the other things that you checked off? So would you check your car if the engine light went on? Symptoms are a warning. All those things are symptoms. They're a warning that something is wrong. There's no such thing as a normal symptom. You would check your car to make sure it didn't get worse. If your engine light goes on, let me ask you, is anybody here who puts a piece of black tape on that engine light? You just put a piece of black tape on it, everything's okay. It's similar to taking drugs sometimes for some of the symptoms that we have. It's like covering it up instead of getting rid of the cause. But with your car, what would you do if the engine light went on? What would you do? He'd say, ignore it. Just keep driving. Oh, well, that's until you don't do anything else. Don't spend any money on it. Yeah. So, well, you don't want to do that with your body, do you? You don't want to just drive it into the ground until you can't move. So I'd say most people will take care of their car sometimes better than they take care of the bus, unless they have 278,000 miles on it. They're great. They're great. They really do last wonderfully. But our bodies, are important. We should take care of them well. So ideally, if you do have something wrong with your car, most people take it to a mechanic or to a dealer, and they look under the hood. And that's what I want you to think about. If you have a symptom, something that you're not happy about having on a regular basis, you should have somebody take a look at it and tell you how you can really get rid of the cause. The cause, not cover it up. So today you have 2 choices regarding your health. You can do the same things you're currently doing, whatever you're doing for any of those problems that you have on that page. And I would say, ideally, I think you would want to get rid of as many of them as possible. Or you can try doing something new and do something different and get a different result. The choice is yours. So if you keep doing the same thing over and over and over again, and you expect a different result, what is that?
Say that's insanity.
They say that's insanity. So think about that. Are you doing the same thing over and over again, and the pain's not going away, or the problem's not going away, or it's getting worse? You're doing something that really, really is insane. It's not a way to fix a problem. So if I could show you today how to decrease your pain, reduce your need for surgery, reduce your need for medication by doing something safe, effective, natural, affordable, would you do it? How many people would say, yes, I do it. I mean, it seems like that it's a no-brainer. I mean, if you could find something like that, then I think it's the ideal solution. Okay, so I'm going to talk to you about something called functional medicine. Has anybody ever heard that term? Okay, nope. Okay, what it means is I'm a doctor who's certified in functional medicine. I'm a certified functional medicine practitioner. And what we understand is that our bodies were designed to be healthy, and what we do is screw them up. Okay, really, we do lots of things that aren't very healthy for them. So my job, when somebody comes to me and they have problems that are on that sheet of paper that I've helped people with, help lots of people with those problems. The functional medicine approach is to identify the cause of any disease or symptom. The body can heal and defend itself against all types of problems if the cause is removed and not just covered up. If you just cover it up, it tends to come back. Functional medicine is the science of creating health. Traditional medicine is the science of really diagnosing and treating disease. It's a different approach. A side effect of creating health is decreasing and preventing disease and pain. And we want to discover why you have something, not what you have. What you have becomes pretty obvious most of the time, but why you have it takes a little more detective work. Everybody with me? Okay. I'm going to skip this slide, actually. Okay. I'm going to read you a testimonial from one of my patients who had severe problems after neck surgeries. So after 2 neck surgeries, I had pain throughout my entire body, including headaches and neck aches. And he thought that everything would go away after 2 neck surgeries. I couldn't sleep, was very depressed, lacked energy. I couldn't bend my back or turn my head. I was then diagnosed with degenerative disc disease. Anybody ever been told they have that? No? Okay, it's not really a disease. It's really wear and tear on your body. And so it's scary when they use the word disease. I just tell people it's really wear and tear, and maybe we can decrease the wear and tear, and all of a sudden things get better. So a disease sounds like something you can't fix. And so he was then diagnosed with degenerative disc disease with lower back problems, and he decided to go to Dr. Markowitz, and in just 3 weeks, he noticed a big difference. I'm not taking any pills for pain, sleeping, or depression. I could just go on and on. I just want to say thank you. I haven't been this happy or felt this good in a long time. And this is just one of many, many testimonials I get from similar patients with similar problems. I think Leah mentioned that I was on the spinal surgery committee at the Embry Hospital, and I was one of only 2 chiropractors in the area out of 100. In the area, I was one of the ones that was picked to be on that committee because they knew I really had advanced training and I had a lot of success with the patients that I treated. And I saw the worst of the worst. You know, it's hard for somebody to come into my office and have something that's worse than what I've seen already. People with multiple surgeries, people who've had they couldn't have another surgery because nothing was fixing their problem. People on pain medication for years and years because there was no other solution that medicine had to offer. And I saw those people and tremendous results even with people like that. So I'm not saying I fix everybody, but there's always a chance unless you have tried everything. And so people thought they tried everything when they went to their medical doctor and they had medication recommended or they had a surgery recommended. There is a whole other area of expertise that could be used to help people. So medicine, alternative. So let's say in the medical column, you might go to an orthopedist or a neurosurgeon. Anybody ever been to orthopedist? Yes? Okay. Neurosurgeon? Yes? No? Okay. Or any of these other specialists. And the thing about that is they're dealing with a part of your body. Whatever you're complaining about, that's what they look at. I look at the whole body and how's it connected and why do people have lots of symptoms like you have on that page? Many of them may be connected. They're really, really coming from a few sources of the same problem. So alternative doctors are like naturopaths, acupuncturists, homeopaths, chiropractors, massage therapists, nutritionists, stress management specialists. I call it 2 merry-go-rounds. And sometimes you're only on, okay. Sometimes people only get on this first merry-go-round and never get off. They go to one doctor on this merry-go-round to another. Has anybody felt like that? They're being referred a lot to other doctors. And sometimes the solution is there, but it really is the same tool bag that all of them are using. So what's in the tool bag of a traditional medical doctor? What do you think? What tools do they have? Prescriptions, big. I mean, that's 90% of what they really help people with. And if it's a surgeon, it may be surgery also. So the ideal thing is a combination of the two. I'm happy if I can reduce somebody's need for medication. I'm happy if they don't need another surgery. I'm happy if they really, really get rid of the cause of their problem. So a combination is the ideal thing. I don't want to substitute for your primary care doctor. I would never, ever, ever suggest that. I don't take people off of medication that need to be on medication, because sometimes they do. But I would say my job is to try and limit your need for it, maybe even make the medication work better by what I do. Does everybody understand that you still can add something to what your doctor may have already prescribed for you or said that this is all we can do? Okay. So I think people should start with the kind of the most, I call it the most conservative thing. I don't know why this laser is not showing up, but the bottom says, this is a logical progression of treatment options for eliminating or decreasing pain. Would you start with surgery first if you really? Okay, so it's a little step ladder. The first approach should be, I'm going to talk to you about a unique, comprehensive approach to naturally reduce pain. The second step might be medication in addition to that. The third step should be surgery. And what we know from statistics, 42% of people that see a surgeon first have surgery. 1.5% of patients that see a chiropractor first have surgery. Think about that. 20 times less often, almost 30 times less often. Limit your need for medication and surgery. That's part of my message today. People always ask me, is your care covered by insurance? I'm going to read you something about the policy of Medicare so that we get this out of the way. Medicare says that care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary. So there's nothing in the Medicare guidelines to tell doctors, listen, I want you to prevent that person's problems. They don't allow charges for that. And so the doctor's a little bit handcuffed. He can only give you something that really gives you something to cover up your symptoms, or to cut out, or to do some sort of procedure to diagnose the problem perhaps better. But why do you still have all of these things on this survey that I gave you? Why do you still have them if you've been going to a really good doctor? Because the approach is not the ideal approach. The approach is to get rid of the cause, should be to get rid of the cause. And so we have ways to make our care affordable, even for patients who've been on limited incomes and disability. I try to make it affordable and available for everybody. What can you do to reduce or eliminate pain? Well, you can actually get involved in reducing your pain by knowing some other strategies that your doctor hasn't told you about. That's what we're here for today. Okay? Okay. Say okay. Okay. So these are my unique approach. The 7 drug-free strategies to decrease pain and inflammation and improve energy. So think about whether you've had any of these offered to you. Pain reduction and non-surgical disc decompression. Anybody have that? Disc decompression? No. Anybody have specific supplements that were recommended by an expert? Not that you bought in Costco or CVS. No. Anybody been told, hey, maybe your weight is part of the problem? Yes, you've been told that. Has anybody really, really helped you lose weight, know how to do it, keep it off? Anybody done that? That's prevention. That's really, really important. Dietary changes. I look at a diet diary on every patient that I see. The first time they come in, I want them to fill out what they've been eating. And I look at it, analyze it, and really can almost immediately tell why they're having some of their problems. Stress reduction. Anybody work with you to help reduce stress? Anybody who doesn't have stress here? Anybody? No. It's a stressful lifestyle that we have in modern society. So I would say anybody work with you to do that? Okay. You know that 90% of doctors' visits are in some way related to stress. Doesn't mean it's totally caused by it, and it doesn't mean it's just in your head. It really means that stress is so unhealthy and that people really don't realize that that's part of the cause of their problems. Somebody should be teaching them how to reduce the bad effects of stress. Anybody teach you how to sleep better? Anybody have a sleep problem? Pretty common. That's when your body repairs itself. So how can you be as healthy as possible if you don't sleep well? You can't. You even age faster when you don't sleep well. You get older faster. Personalized exercise. Anybody in your doctor's office teach you about personalized exercise? PT did. Okay. Sometimes discovering and improving the root causes of your pain and other health-related problems. But this is all combined. Some people need all of those. Some people need some of them. Some people need one of them. And I would say everybody's a little bit different. Strategy number one, pain reduction techniques. I'm going to talk to you about something called the Cox technique, which I use every single day in my office. And I've done about 100,000 Cox treatments during my 40 years in practice. I've had 15,000 patients, actually a little bit more than that now. And I use this every single day on patients. And it's a tremendous treatment to help people feel better as far as neck and lower back pain. Danny, I'm going to show you a little video about it because I want you to know what it is. And I want you to guess about it. And this is going to be by the teacher or the founder of Cox Technique. His name is Dr. James Cox. He was my teacher. This is where I learned this technique.
Website, practice support materials for patients and doctors, communication for the Cox 7 table manufacturer, Haven Innovation, and content director for the Cox Technique Complete program. It's a pleasure for me to work with doctors, both certified and non-certified in Cox Technique, patients, researchers, and all those involved with the technique. The information online about Cox Technique, or flexion distraction as it was first coined by Dr. Cox in the 1960s, has grown. We would like to contribute to this information with some official demonstration of Cox Technique, its protocols, goals, and research. Here is Dr. James Cox.
This is what Cox Technique looks like. Hello, I am Dr. James Cox, developer of Cox Technique flexion distraction and decompression spinal manipulation. Note that Cox Technique is gentle, it's smooth, it's rhythmical, it's doctor-controlled and specific level applied to the patient's spine. Whether treating the low back, as I've been doing here, treating a cervical disc herniation in the cervical spine, the treatment is always the same. It is smooth, rhythmical, slow, and specifically applied. In the years since I introduced and first called this technique flexion distraction, Cox Technique has grown in the science, acceptance, and effectiveness. I proudly share it with my chiropractic colleagues, of whom 64% report that they use Cox flexion distraction in their clinical practice. In light of this proclaimed usage, I strive to establish Cox Technique responsibly with research, education, and documentation. With the National University of Health Sciences, the Cox Technique certification course offers training in the proper application of this technique, and nearly 2,000 chiropractors have taken advantage of this certification opportunity. I am humbled by each certified Cox Technique doctor's dedication to caring for spinal pain patients in a classic chiropractic way using their hands. The certified Cox Technique doctor uses his or her trained, experienced tissue tension senses to monitor this adjusting procedure at all times. The certified doctor knows the importance of careful tolerance testing throughout the application of this treatment. Yes, it looks easy. I hear that all the time, but it is the balance of the hand pressure and the table motion that requires skill and experience to optimize patient clinical outcomes. The certification course we mentioned ensures that the certified doctor experiences the proper force application. Further, Cox certified technique doctors know Protocol 1 and Protocol 2, which are the divisions of types of patients with back, arm, and leg pain, which we treat. Certified Cox Technique doctors fear not the worst spinal conditions, such as spinal stenosis with a disc herniation, or post-surgical continued back pain, or the simpler, yet no less painful degenerative disc, sprain and strain, or facet arthritis. Certified Cox doctors practice in the knowledge that there are documented clinical outcome studies which detail the number of days and the number of visits required to attain maximum relief for their patients. That there are also clinical guidelines that lead the doctor to gauge patient response and to know if that response is expected and adequate to meet the patient and the doctor's clinical expectations. There are federally funded research studies that show the millimeters of pressure that Cox technique drops inside of your intervertebral disc as we apply technique as you see here. Again, in treating the thoracic spine, again, the doctor's contact is specific. It's gentle. It's a smooth movement of decompression with the bottom section of the table. It is very specifically applied to the given level of the spine that is creating the patient's pain.
I invite you to visit these websites for more information on the Cox technique, its certification course, research and referral directory of certified doctors, the Cox table by Haven Innovation, the preferred instrument for Cox technique spinal manipulation, and Cox Technique Complete, the clinical practice program for flexion distraction practitioners' use to tell their communities that they are the spinal pain relief specialist to see.
So that's why I was chosen to be on the spinal surgery committee. That's one of the reasons, is because they knew I was safe, gentle, effective, scientifically proven, and an alternative to surgery and medication. I'm nowhere. Okay, it jumped ahead a little bit. Okay, that's okay. So I'm going to teach you about one other technique that I use every day. It's called Graston technique. These are things that most people don't know about and really have a hard time finding a doctor who's an expert at it. So let's play that one too. It's only a few more minutes. But these are very, very unique treatments that I have in my office and have done for 40 years.
The Graston technique is a unique method of instrument-assisted soft tissue mobilization where we use stainless steel instruments to assess and treat soft tissue dysfunction. The instruments are made of a very dense stainless steel. So as the clinician glides the instruments across the tissue, the abnormal tissue texture will actually be amplified through the instruments into the clinician's hands. So the clinicians are still using their hands. They're just using an instrument between their hands and the tissue to, again, amplify that abnormal tissue texture. So we use the instruments diagnostically to identify areas of restriction or fibrosis or dysfunctional soft tissue. Once we identify those lesions, we can very specifically manipulate that soft tissue with the instruments. It could be uncomfortable. But I would say that Graston technique is actually more comfortable than what is traditionally done with a therapist's hands or fingertips. The treatment edges are very precise, and it allows the clinician to treat this tissue much more specifically than what they typically could do with their own fingertips. So it really is a more comfortable intervention than what is traditionally done manually. Treatment duration really varies by the injury. The longer an injury has been sustained or is there, the longer it will take to recover. So acute injuries.
So has anybody ever had that treatment? Okay. If you watch sports a lot, you'll see it being done on the sidelines of professional athletes because it gets them back to playing faster than anything else. And I've had massage therapists in my office for over 40 years. And I added this technique because there was a limit to what I and the massage therapist could do. Once we added this, it was like another level of helping people with difficult problems, people who had old injuries and scar tissue. And so the other thing that it really helps tremendously is arthritic problems. I've had many, many patients who've come to me, let's say, for example, with knee problems. Anybody ever have a knee problem? Yes, you do? Well, I have one in particular. One of them is her mom. Leah, your mom had a knee problem, right? And she was told that she needed possible knee replacement and looked at her knees and started doing Graston technique is one of the main things I did. In addition to the Cox technique, she's doing 90% better and she doesn't need the knee replacement as long as she follows my instructions. So we help people prevent surgery and feel a lot better without medication. So I wanted to show you these two techniques. They're really unique. You won't find them in offices that easily. And anybody with experience that I have, as I said, I've done 100,000 Cox treatments and probably 20 to 30,000 Graston treatments during my period in practice. I also do acupuncture, electrical acupuncture, not needles, and I do it with electricity. It's another way to decrease pain naturally without you needing medication. So if you're frustrated by taking a pill for every ill, how many people are frustrated by taking a pill for every ill? It's so common. This is what I get in my office all the time. I'm tired of taking drugs, doc. Is there something else I can do? You know, I walk into the office and as soon as I'm there, the doctor's giving me a prescription. How long is the visit in a doctor's office on the average? What would you say nowadays?
Just minutes.
Minutes.
Yeah.
Yeah, minutes. You know, I know that. And they're being pushed to see as many patients as possible, and they're being handcuffed by what they can do. I don't blame doctors. I really think they're wonderful. Some of my best friends are traditional medical doctors, and they're doing the best that they can with what they've been taught and what the insurance companies require them to do. So there's also specific supplements that decrease pain and improve energy and decrease your need for medication. Are supplements necessary? Some are. Which ones are the key? If you're buying them because you saw them on television or they're on sale in Costco or CVS, most of the time they're not going to do you that much good because you don't know the company that really manufactures it, what's in it exactly, and is it right for what your particular problem is and what the dosage needs to be. So the quality is very, very important. It's a totally different story depending upon what company's making it. A doctor with experience like myself, this is something that I've studied for 40 years also, is how to use food as medicine. Test, don't guess. Sometimes we have to do some blood testing also to really figure out what somebody's deficient in. Supplements are not a substitute for a healthy eating. So supplement means in addition to, okay? That's what it means. It doesn't mean instead of. So you can't eat Twinkies all day long and take a vitamin and think that you're going to feel okay. It's just not possible. You have to do both. You have to supplement in addition to healthy eating. Okay. Decrease pain and inflammation with excess weight. Okay. Benefits of losing weight. Decreased inflammation and pain. Every fat cell in your body is like a little hormone factory. And the more you have, the bigger that they are. They actually get bigger. You don't actually get more fat cells during your lifetime. They just fill up more. They're producing more and more inflammatory hormones. So even if you lose a little bit of weight, and you know, I get lots of people, oh man, I've tried, I've done this, I've done that. You have to have somebody who coaches you through it, who teaches you how to do it and is successful at doing it with you. You can't just give somebody a piece of paper and say, here, do this. It doesn't work. But if you ever come to my office and you need help with weight loss, I do it personally. I figure out how you're going to lose the weight, how much you want to lose, and you don't have to be afraid of giving up everything that you ever liked in your life. But you do have to make some changes because what you're doing now is not allowing you to be as healthy as you should be. So inflammation is a big problem, and food is a really terrible inflamer of your problems, especially arthritic problems. It's almost like those joints become more sensitive when they are exposed to the wrong foods. It increases your energy to lose weight. It decreases your cognitive decline. People who are on, let's say, a sugar-rich diet have, well, anybody been diagnosed with diabetes or pre-diabetes? No? Okay, luckily. But anybody diagnosed with diabetes is 4 times more likely to have Alzheimer's at the end of their life. People don't know that. And diabetes is an epidemic, but it's very preventable. If you catch it early enough, you can prevent it. So it improves your ability to move and exercise. Lose weight, feel great. And I actually change it around. Feel great, lose weight. You start to feel so good when you're doing the right thing for your body that you really get motivated to lose more weight. Okay, so strategy number 4, decrease pain and improve energy by dietary changes. Look, food can be your best friend or your worst enemy. So the people up on top are eating, you know, carrots and vegetables and fruits, and the people on the bottom had pizza and beer. And look at how they look. I mean, you know, it's an exaggeration, but it's also true. We feel different when we eat crappy food. You feel better when you eat better food. You want to feel better? Start doing something different. Okay? And get a coach who can help you do that. For diet and nutritional factors, food can be your best friend or your worst enemy. Anybody here who wants to age faster? Anybody? No? Come on. Well, nobody wants to age faster, and nobody wants to live to 100 if they're in a nursing home at the end of their lives, or in a wheelchair, or not enjoying their lives or their grandchildren or what they really want to be doing. So my goal is to make people feel better longer, not just feel better temporarily, but feel better for a longer portion of their life. So an anti-inflammatory lifestyle decreases pain and chronic disease and leads to increased lifespan and health span. So when you go to the orthopedist and he just says, oh, do these exercises, he's not really paying attention to another part of what makes people have less pain. This was an article written 25 years ago in Time magazine. Everybody knows Time magazine, right? And it's called The Secret Killer, the surprising link between inflammation, heart attacks, cancer, Alzheimer's, and arthritis is another big one, and other diseases. And you could do something to fight it. You could have done something 25 years ago if you read this article or saw a doctor like myself, or you can do something about it now. It's never too late to do something about how you feel and your health. Symptoms or signs that commonly improve with an anti-inflammatory lifestyle. These are all the things that can get better. Pain, fatigue, memory problems, insomnia, depression or anxiety, GI upset, mood swings, acid reflux, weight changes, constipation or diarrhea. Now, the medical approach is give somebody a medication for each one of those things. And I'm telling you that there are a few things that really fix almost everything. In 70% of the time, people's symptoms go away within a month of doing what I tell them to do, within a month. It's really amazing. But you have to do something different. You can't just keep doing the same thing. So a short-term detoxifying anti-inflammatory diet can drastically change your pain and other symptoms below the ones that we're going to mention within a week to a month. Decrease pain, increase energy, improve overall health, jumpstart your weight loss, decrease your food cravings, because people are addicted to certain foods. And you may not notice it now, but if you crave certain things, you're addicted to them. And it's just like a drug. You have to get off of it, or you have to cut it down. You have to figure out how to decrease your cravings. Decrease memory decline. With detox, health improvement changes are often noticed quickly, 1 week to 1 month. It's a miracle at times. It really can be a miracle. Stress. Like I said, everybody's got stress, right? Everybody here? Stress picks on your weak spots. So whatever weak spots you have in your body, some people they'll feel it in their gut, their stomach. Some people feel it as headaches. Some people feel it as tension in their muscles. Some people feel it in their joints. Some people feel it just they can't think clearly. Stress causes weight gain. The more stress you're under, the more your body wants to hold on to weight. Very important too. Stress increases inflammation. So you got to do something to balance the stress. And some of the things like breathing properly. I gave you a little handout today also, and you can start using that. It's a little tool that makes a big difference. Anybody here on blood pressure medication? Yes? This will lower your blood pressure 10 points in 2 weeks. Diaphragmatic breathing, if you want to do that. So really, really a great, but you may need somebody to teach you how to do it properly also. Improve sleep. We talked about that. Okay. Anybody here who sleeps on their back? Anybody here who sleeps on their side? Yeah, who's side sleeper? Anybody here who sleeps on their stomach? No? Anybody here who doesn't sleep? Oh, most of you maybe. So, the thing is also, I want to point out what causes sleep problems instead of just giving, the cause is not a deficiency of wine, vodka, scotch, Tylenol PM, Ambien, Lunesta, melatonin. It's not any of those things. That's not what's going to fix the cause of your sleep problem. It's a combination of what I said before, food and probably stress and maybe some also physical pain. If you're in pain, it's hard to sleep comfortably too. If you get rid of those things, all of a sudden this gets better and you live longer and you have more energy and your body repairs itself. But if you don't get rid of this, it doesn't have the advantages of sleeping well. So it's really, really important. Okay. Again, anyone who wants to age faster, ignore your sleep problem. Forget what I said and just kind of keep having trouble sleeping. But if you want to start to age slower, feel better, you got to address the cause of it. Exercise. Exercise is something that's necessary too. And it doesn't have to be, you don't have to be a marathoner. You just got to move a little bit. You have to start moving. Moving is what we're supposed to do. If we stop moving, our bodies really start to deteriorate faster. It's like a car. If you left it in the garage all the time, would you expect it to start up every day after a while? Maybe a Toyota, right? Maybe a Toyota would do it, but that's about it. But you have to actually you actually have to give the car good fuel and maintenance and take care of it. And you can't just let it rot in the garage. We've all seen cars that are, 2 years old that look like they should be in the junkyard. And we've seen cars that are antiques that look like they're brand new. It has to do with how you take care of it. Your body deserves that kind of attention. That's what I give people, that kind of attention. Exercise daily. Okay. So a little bit about, I call it our Restore Your Health program. It's all inclusive. It includes everything. Nutritional guidance, talking to you about supplements, talking to you about how to reduce your stress, talking to you about teaching you, not just talking to you about, teaching you and holding you accountable, teaching you specific exercises that are good for you. Lab testing that really may be necessary at times too. You have access to my private email and my phone line because I don't want you to feel lost out there. I don't want you to be put on hold. I don't want you to be called 5 weeks later. I want you to be called right away if you have a need. Patient-specific and physician-supervised weight loss. I'm really good at helping people with that. So you can have your best life if you want to. You can really, really improve. I don't care what you came in here with. And some people are at a level, 2, let's say 0 to 10 is the wellness scale. 0 is you're dead, okay? 10 is the best you can be. And you're at different stages, but I want to move you closer to the 10. Not everybody can reach 10, but you want to be closer to it. Okay, this is a little bit about the program. It's physician supervised. Myself, I used to have 3 offices, and I've really reduced it to 1 office now. I don't work full time. I'm there when I want to be. I see the patients that I want to see. I don't get dictated to by insurance companies. I give people the care that I would want and that I get. And that's really, really what my goal is, to give people the best care they can get that they're not getting already, because I know what the health of America is like. It's not good. It's really not good. Determine the underlying cause of your problems, create a unique plan, educate and empower, guide you through your journey, hold you accountable. If you go off course, I bring you back on course. It's like, anybody drive without a navigation system, Or, huh? Not anymore. You get lost. I mean, and now we don't get lost. And people get lost. It's almost like, they start doing this and then all of a sudden Dr. Markowitz told me to do that, but I stopped doing that. So you have to be accountable. You have to be monitored for a while until you get it, until you really can kind of do it on your own. And we encourage you and we celebrate the fact that you're succeeding. It's a joyous experience to feel better. Educating alone is powerful, but not as powerful as education with action, which can be life-changing. Does anybody ever know of somebody who graduated from even like the Ivy League schools or really, really a wonderful school, and they really never amounted to anything, or they never really used their education to the fullest? So I think about that when I talk to people. If they just sit here and listen, you're good listeners, all of you, good listeners. But if it goes in one ear and out the other without changing something in the middle where you do something about it, it's not worth very much. So fixing your health problems yourself after today is like trying to fly a plane after listening to a lecture or reading a book about flying. You need guidance and treatment. Think about it. Would you go fly a plane after after a pilot talked to you? So I'm an expert at helping people be healthier. You can't just fly your own plane after this. You need some help. There's hope. Utilizing the strategies which remove the harmful effects of stress, learning how to eat healthy for life, reduce pain, have less pain, have more energy. You can have all these things. Sleep better, become healthier, limit your need for medication and surgery. Everybody needs a coach. Anybody here of Michael Jordan? You know who he is? Everybody? Okay. Greatest basketball player ever. What people don't know is he was a great athlete when he came out of college, but he couldn't win a championship. And then all of a sudden, he got matched up with somebody called Phil Jackson, who became his coach. And then he won 6 championships. So Phil Jackson got him to live up to his potential. And that's what I'm talking to you about now. You all have the potential to be healthier. You need a great coach to help you do that. That's what I do. So I offer everybody who comes here an opportunity to schedule a 60-minute comprehensive consultation for a cost of $95. Normally, it's $395 if you don't come to one of my lectures, because I spend an hour with you. When's the last time you had a visit with a doctor that it was an hour? Ever? Maybe never.
Yeah.
So I have to dig. I can't just write a prescription. That takes 30 seconds. I have to dig at why you have the problems that you're coming with and which ones are most important to you and what you've tried to do that didn't help and what you tried to do that did help. And I will look at even any tests that you've had or blood tests that you've had recently. So I'll review those, because when I look at a test, it'll be different than perhaps your doctor's recommendations. He's looking for what's called normal. Normal doesn't mean healthy. Normal means you're like everybody else, pretty sick. That's what normal means. No offense, but that's the truth. The normal range is very big. The healthy range is smaller. I look to see if you're in that healthy range, not just normal range. So it's different. I'm just telling you, you're not going to get that from any doctor that you've probably been seeing already. So, or if you just want to, I would be glad to call you before, let's say you're thinking about it, we give you that option too. I'd be glad to call you, talk to you a little bit more privately, and no obligation. I'll just talk to you, ask you some of the things that I think will help me decide whether you're a good candidate for what I do. I don't take everybody as a patient. I don't want failure. I want success. So I would say, but I try to give people the best chance for success. If they want it, I want it. And so I would say that's really my goal. And this is valid for a couple of weeks. I can't do it forever. We have time set aside that Leah has in front of her. Anybody who wants either an appointment for a call, or you say, hey, what Dr. Markowitz said today really sounds good. I'd just like to make the appointment for the consultation, comprehensive consultation. So you have a choice. You could choose one of those two things, and we have appointments for the next couple of weeks set aside, because I knew how many people were coming, and I'd say, I think we have no problem accommodating you within the next couple of weeks. What does that consultation include? A review of all past imaging and testing that you make available to me. Whatever tests you've had, blood tests, x-rays, MRIs, if you give it to me before this comprehensive consultation, get it to me, and Leah will tell you how you can do that. You can fax it to us or email it to us. I'll look at that. I'll spend time. Besides the hour I spend with you, I probably spend another hour reviewing what you've done already. A screening test for stress. Nobody does that. It's part of a form that we fill out, and we do a physical test to see how stress is affecting you. Testing for undetected nerve damage, that Cox technique, that's part of what we do, just to see if somebody's a good candidate for that. I look at your diet. I look at that also. You fill out a diet diary before you come into my office. We measure your percentage of body fat. So weight is one thing. We want to know how much weight you should lose, how much weight you could lose, how much weight you want to lose. And so we measure your body fat, which tells us a lot about that. Sometimes feet are a problem and your pain is in your back. I don't know if you anybody had foot problems per se? Maybe, maybe not, but it's not necessarily just that. And that can help lots of things, because we're standing on our feet all day long. It affects everything. It's like having a bad foundation. So we do a computerized foot scan on everybody, whether they complain about their feet or not. And then I come up with a plan. Before you leave that, after that hour, I will tell you what my plan is to help you. So you'll know exactly what it is. You'll know exactly what it costs, no surprises. And so I would say some people can't make it to my office. I do it by telemedicine if you want. I would say the first visit has to be in person. But if you really say, hey, you know what, I can't, we can accommodate you and help you anyway, even if you don't make it to the office for every visit. Okay, there's an envelope that Leah will give you. In it, it has a wellness profile. It has a symptom analysis, has a diet diary, a weight loss profile, and it tells you what we just read to you, or what's included in that 1 hour consultation. So you have a little form. You can check off, I'd like the doctor to call me to discuss my health problems before making an appointment. That's choice one. Choice two, you already know that you need help, you want help. It's worth $95 to find out how Dr. Markowitz might be able to help me. And you could check that box if you'd like a $95 consultation, an hour consultation and screening, and we'll contact you to schedule an appointment. So you can write your name and phone number on that, and that's valid for a month from today. There's something called a discovery call pass. I don't know if we have any of those. Leah, do you have any of those with you? I may have them. So I like to make as many people healthy as I can. So if you know somebody else who is suffering with something that they just haven't found the answer for, I will make myself available for a phone consultation for them too. All you have to do is tell Leah, we'll call them. Okay? So I would make that available for you also. Any relative, any friend, anybody, I will give them the time just to at least talk on the phone briefly and figure out if I think I could help them. So schedule at least your free consultation for phone. On the phone today before you leave, we've set aside time so we can determine if your health concerns can be helped by our office. Anybody who's on Zoom, this is for you. I don't know, I might have been blocking some of the camera, but anybody who's on Zoom, all you have to do is call our phone number 203-798-WELL. 203-798-WELL. And if you call and say, I saw Dr. Markowitz at the Bethel Library and I'd like to get a free phone consultation, we'll be glad to honor that for anybody who's on Zoom. And we also are leaving packets of information for anybody who's on Zoom. The same thing that my audience here got today, you're going to get if you come to the library or if you come to the office. I would say, I really thank you. I will be here if you want to ask me something. If there's something that, you know, you don't want to, if you don't want to talk about it openly, the phone consultation or the office visit is probably what you should do. If you want to talk about it, I'll be here to talk to you about anything that concerns you. No? You're good? Anybody? Okay. But thank you for coming.